According to a newly released study, St. George Regional Hospital ranks fourth in the nation among community hospitals out of 50 top-ranked heart hospitals. The study by Premier uses publicly available data, including AI, to annually assess performance among America's best cardiovascular hospitals. The data-driven award cannot be applied for, but rather is earned.
The unique things about that is it can take the bias out of it. There are other ranking programs where you sometimes put a strategy together to be ranked well, right? That's not the case here. That's why we feel very comfortable telling our mother that this is an award that we congratulate, that we welcome, and we congratulate the teams, the physicians, the nurses, the staff, the operators, the managers, the CEOs, everyone, that this is a collaborative effort and it actually means something.
Dr. Blake Gardner, who is the Senior Medical Director of the Heart and Vascular Program here, says he believes it's due to the philosophy and team approach.
About a decade or so, there was a very deliberate and intentional effort to create an environment for our heart teams, and very much so with our physicians, to work in a very team-based, evidence-based environment. And that's not an easy thing to do in healthcare in the United States to do, but the providers and the physicians that we bring in love the team-based environment they have, and that translates into typically better outcomes.
This approach is especially important because heart disease is the #1 killer among both men and women in the United States.
And it's projected to increase. And on top of that, the models out there are projecting the workforce to decrease, and which reaffirms that we're approaching this in a way that we think is very wise.
Changes in technology, procedures, and preventative care are all key to improving heart health.
Technology, to your point, has advanced considerably, and with that it became more expensive. And I think we're now at a point where we have to re-examine how efficient we are in the things that we're doing to make sure that we're optimizing outcomes at the lowest possible cost for the communities. We're very much involved in proactive care. We're very much interested in reducing the cost of care. We recognize that in our therapies we're on the cutting edge, but our ethos tells us we actually want to prevent people from even getting to that point.
Also in the study, Intermountain Medical Center in Murray ranked third among hospitals with a cardiovascular residency or teaching program, and Intermountain McKay D Hospital in Ogden ranked first for hospitals without a cardiovascular residency program. Dr. Gardner says his heart health teams at Intermountain St. George will continue to develop new treatments to help patients live their healthiest lives possible. In St. George, Melissa Anderson, Community Education News.